Sex and women's health have always been subjects surrounded by myths, misconceptions, and silence, and these false beliefs not only create confusion but also damage women's physical and mental well-being. One of the most common myths is that women do not enjoy sex as much as men. Whereas medically and psychologically it has been proven that women are capable of experiencing equal or even greater pleasure due to their complex hormonal and emotional connection, yet cultural barriers and taboos stop them from expressing it openly, leading to the mistaken belief that female sexuality is less significant. Another widely believed myth is that sex during menstruation is harmful, but doctors explain that while menstruation is a natural cycle and having sex during this time is not inherently dangerous. The only risk lies in hygiene, since menstrual blood can increase the chances of infection if proper protection is not used. Therefore, it is not about prohibition but about understanding and practicing safe hygiene. Another damaging myth suggests that only men have a high sex drive while women are naturally less interested. Yet scientifically, women's libido fluctuates across their cycle, often peaking during ovulation due to hormonal changes in estrogen and testosterone, proving that desire is equally natural for both genders. A related misconception is that after childbirth women lose their sexual desire permanently, which is false because the postpartum phase brings temporary hormonal changes, fatigue, and physical recovery that can reduce interest for a few months, but with time, support, and healing, women regain their sexual health and intimacy. Contrary to the myth that contraception harms women's fertility, modern medical research has shown that contraceptives like birth control pills, IUDs, and injections do not cause permanent damage to reproductive systems. And once a woman stops using them, her fertility returns to normal, although in some cases it may take a few cycles to regulate, but this is temporary. One of the most harmful myths is that women should feel pain during sex, a belief that makes many women tolerate unnecessary suffering. Yet medically healthy intercourse should not be painful, and if a woman experiences pain, it may be due to treatable issues like vaginal dryness, infections, or conditions such as endometriosis. So instead of accepting pain as normal, women should seek medical advice. Another common myth is that sex education is shameful and should not be discussed with women or young girls. But in reality, avoiding open conversation fuels misinformation, leaving young women unprepared to understand their bodies, their menstrual cycles, or safe practices, and this silence often leads to preventable problems like infections, unintended pregnancies, or low self-esteem. Society's refusal to speak about sex in a healthy, scientific way creates a culture of fear and guilt, where women feel uncomfortable in their own skin. Another popular misconception is that women cannot get pregnant during their periods, but biologically it is possible if ovulation overlaps with menstrual bleeding, making unprotected intercourse risky, yet the lack of awareness keeps this myth alive. In some communities, there is even a belief that a woman's sexual desire is unnatural or that she should suppress it, which not only denies her natural biological instincts but also reinforces gender inequality, when in fact healthy sexual desire is part of overall well-being, contributing to emotional balance, relationship satisfaction, and even physical health benefits like reduced stress and improved immunity. Further myths suggest that women who talk about sex are shameless or immoral, when in truth, open discussions about sexual health empower women to make informed choices, protect themselves from disease, and maintain dignity in relationships. Still, many societies label women negatively if they express their needs, pushing them into silence that leads to frustration, resentment, and health issues. Medically, it is also a myth that frequent sex causes physical weakness in women, when in reality healthy sexual activity, in moderation and with consent, can improve cardiovascular health, release endorphins, and strengthen intimacy between partners. Another myth is that older women lose all sexual interest as they approach menopause. But studies show that while hormonal changes do affect libido, desire and pleasure can remain a vital part of life if women receive proper medical support, lifestyle balance, and open communication with partners. The myth that only physical aspects matter in women's sexual health ignores the fact that emotional safety, respect, and mental well-being are equally important, because women are more likely to enjoy intimacy when they feel valued and respected, not when forced or pressured. And this is why education is key to dispelling myths across societies. The persistence of these Misconceptions not only harms women individually, but also holds back communities by perpetuating inequality, silence, and shame, preventing women from accessing medical care or speaking about their struggles. Breaking these myths requires families to teach young girls and boys about reproductive health openly, schools to include sex education in curricula, healthcare providers to create safe spaces for discussion, and media to portray sexuality in a respectful, factual manner instead of sensationalized or stigmatized. When women are encouraged to understand their bodies, practice safe habits, and voice their needs without fear, both medical outcomes and social harmony improve. For example, understanding that period sex is not forbidden but only requires hygiene helps couples make informed decisions. Knowing that contraceptives are safe empowers women to plan families without fear. And acknowledging that pain during sex is abnormal pushes women to seek timely treatment, preventing long-term complications. Ultimately, myths about sex and women's health survive only in environments of ignorance, and the responsibility falls on all of society to replace ignorance with science, stigma with respect, and silence with dialogue, because women's sexual health is not just about reproduction or pleasure. It is about dignity, equality, empowerment, and holistic well-being. And until societies embrace the truth that sex is a natural, healthy, and essential aspect of women's lives, myths will continue to weaken progress. But with awareness campaigns, education, and open medical conversations, the future can be one where women are no longer burdened by false beliefs but are empowered with knowledge, respected for their needs, and supported by families, communities, and healthcare systems alike, proving that true empowerment is achieved not only by giving women the right to work or study, but also by respecting their most personal, biological realities with honesty, science, and dignity.